body is one, right? And all these 19 subjects are integrated part of that one human body. Okay. So when you talk about orthopedics, you all must have realized when you're talking about the bone tumors, okay, so most of these topics are taken care by your radiology faculty also. When you talk about pediatric disorders, when you talk about mineralization disorders, they are also taken care by your pediatric faculty. Rickets, malacia, all these things, right? Scurvy, all of are a part of pediatrics. Now, when you talk about the peripheral nerve injuries, right? When you talk about obstetrical nerve injuries, they are also a part of your obstetrical teaching, that which are the more common nerves which are getting involved during delivery time, right? When you talk about arthritis, some of the part goes to medicine as well, rheumatology as well. Okay, so see, it is all about integration, right? And you all have to understand that whenever you are preparing for the exams, whether it is NEET exam, INI-CET exam, or FMG exam, one thing is very, very simple, and you all have to understand this, that till the time you keep, looking at the questions from a student point of view, the questions will always trouble you. And the moment you start looking at these questions from a physician point of view, these questions will automatically become your patients, right? And these are now 300 patients in your FMG exam. These are now 200 patients in your NEET exam and INI-CET exam. So the more you are, looking at these questions as your patients, and you're looking them as the physician, things become pretty easier for you. Okay. So whenever you're looking at a subject, no, always try to understand where the roots are, where the basics are. Anatomy is the base of orthopedics, right? But then when you look at the anatomical part, in anatomy, there is a lot of theory which you have to understand so that you can know and understand the clinical perspective of the clinical subjects, right? So आप कभी भी ऐसा मत सोचिए कि orthopedics is going to have some 5 questions, 7 questions, 10 questions. When you combine all these questions which are a part of your pediatrics, medicine, anatomy, radio, and orthopedics itself, there will be always more than 10, 12, or 15 questions in your exam, right? And out of 200, 10 questions, 15 questions definitely matters. And you all know, even a single question matters. A question wrong or a question right will make a difference of some 1,000 ranks in your NEET or the INI-CET exam, right? 149 marks in FMG, it's the most painful score. You are supposed to just get one more mark and you are supposed to be qualified, right? तो ये छोटी छोटी चीजें जब आप समझोगे तो you'll understand that every subject, every question has a good weightage. All the 300 questions, they have equal weightage, right? हर question का 1 mark है. INI-CET में NEET में हर question के 4 marks हैं, right? So everywhere the weightage of every question is same, and every question means every subject. Okay, so you'll have to understand this integration policy is now working. जैसे जैसे आप exam का pattern देखोगे, starting from this year 22, 23, 24, 25, every year the paper is becoming more and more clinical. And clinical simply means look at the questions as physicians, as simple as that.